the damage is done.
Okay.
So even though we can cry, weep, and everything, you can see the public outcry. You could see that. You could see the response today. And today, the biggest problem we have is the distrust and the trust loss.
We are both Indian. So, in our culture, doctors are worshipped. You are idolized. You are the goal, right? Which is fair, which is fine, because I always considered a doctor to be a noble profession, because, come on, you're dealing with human life. How more noble can you get? And then after that, to every parent wanted their child to be medicine, especially Indians, right? Doctor, do you think medicine is for everyone? Or anyone who can achieve it based on grades? Or should there be another criteria to assess whether can a person become a doctor?
Wow.
Medical field ni nothing pancreatic cancer.
Bersama saya Dr. Roland Victor.
Satu benda yang one of the worst stress can happen bila you makan tak sedap.
Doktor, saya punya culture kena makan nasi.
Zaman moden. But at every second of your life you either earn or learn.
Batu Medic Show. This is a tough question. I think maybe along my years lah. I think what I've seen is like me. Maybe I'm a textbook guy. Like if you see one of my friends from preschool to primary, secondary, it's like this guy is like a bookworm. It's like you sit there and read. And I think I did that even in university. But I realized that there are also the smart kids. They need just to read like once and they get it. And then I'll be sitting down like 2-3 times going. It's like discipline kind of
They call
situation.
that a photographic memory like that. Yeah.
So then comes service. When it comes to service, there are some of us among peers who are very good in tax. They can remember everything. Okay, now it's time for you to do the procedure. They will screw up.
Okay.
But maybe they get better. But then they'll say, hey, you're still stuck. Until today, you're still doing it like this. Like after like 2 years into housemanship or MO and you still struggle into like things. Because so then I realized like even in the Hippocratic Oath, you just realize like medicine is an art actually. Some people they become very good surgeons because they're very calm. Even a situation handling a crisis, there's a growth, a tumor, there's excess bleeding, they don't panic. But some maybe textbook, they go into exam, they will be the 4-pointer. But when it comes to practice,
They're not there.
They probably they have fear. You can see their hands jitter. All of this you can see. You can see even today sometimes when we go for courses. But again, I think there's a need for both. There need some people who are very good at diagnosing.
They should be like
and
more
some,
like in research and all that.
And some of us are very good in hand skill and bedside manners and all. I think, and these are very important tools, even though taught in medical education, but it's lack in practice or it's not seen, because you see we're handling humans, so that soft touch, the interaction of that warmness and all of this, these are expensive also, not just knowledge. It both has to come hand in hand.
One last question on this before we move into the next segment and discuss issues like the budget and all that. Now, if I compare, and I had this thought when during the whole crisis, not crisis, but the protests were being done by doctors on the contract issue and all that, and all that things. If I'm an engineer, say I have an IR title, I am allowed to sign and drawings and all that, right? Now, if that project, that building or that whatever bridge or whatever collapses, or there's an issue that has caused casualties, I am legally responsible. Right? So that's why an IR signature is very looked. I mean, I could be wrong, but it is very much sought after. When it comes to doctors, do you think that there is almost no oversight on the consequences of your work? Because I have been in functions where it's only doctors, okay? And I've heard doctors tell me, okay, that sometimes they recommend surgeries without even needing it. They put in stents when you don't need a stent. There are doctors who do this, right? And this is allegedly. I must be careful. But and when a person dies under the care of a doctor, it is oftentimes taken as that's just life. Okay? Do you think that more oversight or more burden of proof should be placed on doctors to ensure that healthcare, the outcome in terms of the healthcare is better?
I think absolutely. I think, of course, there is issues like negligence. Some people are brought to court for trial. Some are subjected to medical counsel, whether they still hold their practicing license and stuff, specialists and stuff. So oversight exists. The issue is costs to prosecute, cost to pursue a charge and stuff. So when that happens, let's just say there's a mismanaged situation in a government facility. Okay, yes, the government has the DPP and stuff, but for you to get a competent lawyer to go in pursuit for that negligence, it's going to cost you 30,000, 50,000 again. Then if you're talking about the B40 community, that's not going to happen. And even if you're looking for like pro bono lawyers out there, how many are there who's willing to come and help you? Unless it's such a big case and it's like they also want to take center stage.
Correct.
That's a different situation. So that's one thing. And then when it comes to private practice, it's also the same thing. So if you want to sue for negligence, yes, and you need to find practitioners who are willing to take on their peers, one, as an expert witness. You need to find a very competent lawyer who knows some sort of maybe a medical, very significant medical understanding and background to pursue the case. Extracting documents from the hospital in hope that the documents stayed intact, not manipulated. So there's a lot of these things which I was very lucky when I served in the Ministry of Health. Under my department, this is the things that we have to look at for the perspective of the public. Handling private healthcare, but I was looking also at one segment of my task was to look into the grievance mechanism, whether the mitigation or the discussion between the client and the service provider was right or not. If they were still not satisfied with whatever explanation were given, then our option is to look, if you feel that you didn't get what you deserve, then you proceed for legal action. So yes, this what I define as this cover backside medicine is going on. I've
never heard that term, cover.
It's going on where there is a scenario where I call like they are more interested in the medical card than you.
Ah, yes, that's true.
Okay.
That's true. Yeah,
so you walk in with the card, okay, this card you can claim 100,000 ringgit. Okay, I'm going to call all the vultures to come in. Who wants to be referred to this? So but that's the problem today, where we see that the rising cost of healthcare also, because there's no check and balance. For example, if I were to say, okay, you got this thing, I think I can find some problem with you, or we can fix this. You want me to refer? I'll refer you to this guy. I'll refer you to this guy. So there's 10 guys coming in for one case to look at. But one guy can actually manage it. For example, like if I go to when I was an MO in government itself, in the orthopedic department, you will realize that sugar is high lah. Orthopedics don't want to handle. We have all been trained. Okay, we'll up the insulin. No. We will refer to medical to come. So the medical MO must come to this department, review. Okay lah, increase the thing. Just because I just don't want to sabo, or I just want to get involved in handling sugar. So I'm only going to see the bones. I'm only going to plan the fracture and plan to put the implant. This is what happens. So then I'm going to say, look, I'm going to refer to my specialist internal medicine guy to check your sugar. What do you say? Okay. Then comes. And then the guy comes in and say like, I think we need to start you with another insulin. We need to start. So this is what happens. So that's why the bill goes up. Because like something simple, you know what, I'll refer lah. So there comes 270 ringgit. And then that guy will come tomorrow and say, how's your insulin? Okay, another charge. Afternoon, I'll come and check again your insulin. Come again, charge again. So that's why the bill goes. And also another thing you must understand is, all of the specialists unfortunately, if you're watching that, we know this. They report to a CEO who is maybe not even a doctor.
Yeah, definitely.
So what happens in that situation is like, Dr. Vinod, how come your sales this month only 300,000? You expected to maybe make 500 to keep your seat.
My goodness.
And it's like, no, I'm this good doctor. I don't want to prescribe medication, and I'm not deciding these people to go for surgery and everything. You lose your seat in the hospital.
So the system is rigged to incentivize charging patients.
I mean, it is for profit.
Yeah, but there must. But I you know what? I must be honest. When I got into healthcare, and I started meeting a lot of doctors and hospitals, oh my God, healthcare industry is just. I said no, I don't, because I started saying things that I was like, why am I saying things like this? Like, you know, when you want to bring down certain equipment, and then you're like, no, but it's not profitable. Then I'm thinking, but there are still a group of people who need this equipment, although it's a small group, but they still need it. And I started saying things like that because, you know, you think about the profit, and I said, no, I can't do this.
No, because that is how the industry is designed. So like, if the only way to sort of fixing this problem
nationalizing
is no, that's it can be done, but there's going to be random audits. In order to check and balance, there has to be people who are competent to go in and do audits and see whether the practice is right. Because there are a lot of hanky-panky that goes on. For example, if you come in and say, like, look, I want to plan for a bilateral tubal ligation. I mean, for someone who wants to snip her fallopian tubes.
Oh, okay.
Yes, I've got 4 kids. I'm done, doctor. Then the doctor will say, like, you're going to pay yourself or you want me to use the insurance? Then say, can you use my insurance? Can. I'll just put like you got a cyst there in the ovary. Who saw the cyst? How to justify? I don't even need to do a scan to show the insurance company that I proved that there was a cyst.
Not even a scan.
Why not? Why should I? I'm a very competent physician. I can do it. So I can go in, do the tubal ligation, and then claim I have a cyst. So, and then this young woman who's maybe 35 or 36 years old, already had 4 kids, said, I insist I wanted that. 8 years down the line, really has a situation somewhere maybe in another state, had to go for a massive surgery and say, like, oh, there's a cyst again. Open insurance, cyst was done, removed last time. How come the same place? That's where the problem comes later. Like, whoa, query back, why this thing was already removed but not told, or something happened. These kind of things happen. So, like I said, only through a national auditing system where everybody can be placed in line. So, whether in government or in private, if you are able to audit the hanky-pankies with a proper system, or maybe like a task force or Suruhanjaya or Jawatan Kuasa kind of thing, then everybody will be standing in line. They cannot do this kind of thing.
It sounds like the story that we used to read as kids, you know, about the girl who cried wolf, the boy who cried wolf. Yes.
Have you seen one of these Tamil movies where Vijay Khan used to act? There's one old movie there. They will bring a dead body into the hospital, but all the doctors will concur and say the guy is still alive. Go and pay for the bill, pay for the medication. Go and buy here, go and buy there. Probably I will send to you the link to watch.
Oh, really? Yeah.
It's a classic one, lah.
So perfect way to sum up.
End of the day, they will realize that they will show, like, look, I brought this body from the government hospital. He was certified dead, and you tried to introduce all this kind of medication, keep him a couple of days in, and then you say the person died.
Now, speaking of money and payments, the budget is going to be announced this Friday by Dato' Sri Ibrahim. And before that, the Health Minister, Dato' Sri Dr. Zulkifli, has urged for primary healthcare to be the focus that seeks to promote early screenings. That's what you were talking about just now. Disease prevention and healthy lifestyles, which he says should be emphasized. And so I just want to ask you, Doctor, how do you think the spending in terms of healthcare should be done to combat the rise in chronic diseases such as heart disease, stroke, HIV, and cancer?
I think if you look at non-communicable disease would be a big thing to do. It cannot be just on one budget to the other. I think we need to look like how we build like public infrastructures. We need to have like a solid healthcare infrastructure on a long go. It's not just about reward centric. Yes, it's nice to have like some insurance companies have like reward centric. You like Singapore has. If you have your wearable, it's provided by the government.
Oh, they actually provide
for free. And listen to this. So if you achieve like 10,000 steps, for, like maybe for the next 30 days or so, you'll get a movie ticket free, or you get certain discounts given by the state. So it's small things, but at least it measures up.
Yeah.
One. So we need to have like things like almost like a NCD kind of thing, where when you pay your car insurance premium, no accident, you get like a discount. So we need to put that, whether it's going to come through your taxation system, where you subscribe to a gym, you go for certain activities. For example, if you go to like certain marathons, okay, you can all claim all these receipts in.
Yeah.
So then you activate.
You incentivize healthy living.
Yeah, you incentivize healthy living. One, food is going to be very hard lah. I still think food. I think the measures by looking at eating, getting introducing like proper ways. This is not the sugar thing. You're going to look at the big issues, like bigger macro stuff like rice, starch and stuff, which is still not done. Another thing is using electronical approaches, where if you see like the amount of effort done by individual practitioners, like many of them, including myself, it's like we are able to create that much of educational content at the bare minimum cost. But when you look into it, infrastructure agency like government, the amount of budget they have maybe for health education and everything, they should have like electronic programs. Join the course every day, just 10 minutes to listen. We're going to educate. Or if you think that your physicians are not able to read, get the private people, get us to participate into this kind of things, because maybe some people have a significant fan base. They would like to listen to this doctor talk about this doctor. Get it involved. We are part of the system. We are not against each other. We are all in this together.
Yeah, definitely.
One thing. So this kind of education content now just sits in the ward. So if you create a pipeline, people having this issue, people having diabetes and stuff. So you rather move the workforce and get more automation done. For example, like if you're looking at, I think one big thing will be discussed this time is our electronic medical system. We need to get it automated. We need to get like maybe the pharmacy, all the dispensing is all automated. It's don't have to wait someone to tell you. Can you imagine like all the 10 drugs, all you need is just a QR code. If you don't understand, click and watch 100 times.
You'll understand.
You'll understand it. You want to change language, all AI is there to help. You want to change it to Mandarin, you want to change it to Tamil, you want to change it to English, VM. It's just a click away. So it's like we got to think about all of these things. Of course, I think we talk about preventive medicine, we talk about automation, we talked about another thing I think they're going to talk about is definitely they're going to absorb all the doctors who were all on the contracts. I think that's already been done, so they're going to emphasize on this definitely. I think I'm not seeing whether any new hospitals are going to come up anytime soon, but they're going to actually spend a bit more for upkeep. And again, preventive medicine is still going to be the big thing, but it cannot be looked at a short junction. It still has to be something that we need to look at 5 years. We need to have a 5-year, 10 years program, even though we had the white paper like 2 years back.
Yeah, that white paper.
So we're looking at maybe something, I hope 47 billion maybe this year.
All right, so let's hope for 47 billion. Now, I want to go into the next segment, which I can't wait. If you guys are fans of Dr. Roland, his name is synonymous with vaccines. So there are a lot of vaccine talk that's been taking place recently. Of course, most recently, the country has announced, the Health Ministry has announced that they will be receiving the Mpox vaccine soon. So, Doctor, do you think we should take the Mpox vaccine?
I think when you look into the Mpox vaccine, it's actually a smallpox vaccine.
Okay.
So the monkeypox, smallpox, they all belong to the same sort of family. So the Mpox is an old school kind of platform. Technically, we take the virus, we weaken it, we put certain stabilizers, heavy metals inside, standard, which is aluminium. Yeah. There's not music inside, but heavy metals. So heavy metals has been used because in order to trigger.
Slayer in your vaccine. No,
So
you put heavy metals in vaccines.
Yeah, it's always been
Is
there.
it poisonous to your body?
It's very, very minimal amount, but some people have allergies to it. No denial on that. So they used to use mercury. Now they use aluminium.
Okay.
Yeah, I mean this is a standard truth. I mean anybody who opens a vaccine insert will see it. It's there.
Okay.
Because they use it to sort of draw attention from your immune system to come to the location.
Okay.
So then it picks up the protein particles of the virus and then makes an immune response.
Okay.
So coming back to the Mpox vaccine, I think it's a well established vaccine there, but it's not for everybody. So they're not going to roll it out like what we did 3 or 4 years ago. Like everybody must take, no, nothing like that.
Okay.
Because whatever said and done, what we see physicians across the world, I think this monkeypox thing is very manageable. Of course, you need to look at health infrastructures in Africa. We're not expecting that here. So it's much more of symptom management kind of thing. So even though if people who are having immune compromised conditions, then maybe they would be advised to take. So I think a lot of people think that we are against vaccine all out. No, I've never been that. I think even in our clinic, there's abundance of kind of vaccines which are well established. When we look at risk versus benefit, there are many vaccines that has a lot of benefit versus the risk.
Okay.
So when we look in a situation when you have 30 million people taking a product, I define in a more sarcastic term is collateral damage. You send 100,000 troops.
That's not sarcasm. That's evil.
Yeah. So I call it. I'm just being nice.
Okay, fair enough.
Okay.
Fair enough.
So if you send 100,000 troops, are you expecting 100,000 troops to come back?
No, of course not.
Okay. How many you expect to come back?
Depends on the
99%. Let's say 99% comes back. That's a good.
Very good.
That's a good combat. Okay.
Yeah,
That's
very good.
Okay. So what happens to the 1,000 then? What do you do with them?
Casualties, huh?
Yeah.
But
So
you
just
bring
go to
them
the
back
Tugu Negara and then pray. So that's what will happen also in medicine.
Okay.
When we're treating, we know from the vaccine insert or any product insert, there are complications. But what do we do when there's complications? The problem we face for years is denial. That's all. I mean, accept that there were risks and look how to help them or compensate them because you tried an experiment at that point. That's the only thing. But if you are not going to recognize, then you're going to repeat the same mistakes over and over again. And if you as a consumer, you must be given all the information before you choose to take something. Definitely. So whether you feel it's beneficial, fine. I am a physician. I have the power to introduce or inoculate you. But at the same time, I also have the obligation to tell you what is your benefit and what is your risk. And if I don't know what I'm doing, first do no harm. Leave the danger to someone else. And if you choose to go there and you agree to do it, fine. Then he has already given you advice and you have already taken the decision.
Okay, interesting that you talk about the side effects of vaccines. So, of course, I want to go into this. There has been discussion in Malaysia now for a need of a dengue vaccine. And, of course, I think there was a talk done on a forum where they addressed that although there is a need for it, there is a lack of acceptance among the general public because of the misinformation that was surrounding the COVID-19 vaccines, right? Now, in Philippines, there is a dengue vaccine called Denguacia. Denguacia, I hope I'm pronouncing that right, which was rolled out, but unfortunately, it led to a worsening of the illness because apparently if you hadn't had dengue before, it would lead to the illness becoming worse in you.
Yes.
So can we ever trust vaccines, doctor? You're asking us to take it, but come on, there's so many side effects. COVID, you were very vocal about the COVID vaccines. Now dengue, come on.
Yeah, so when you look at drugs and pharma industry, there's always going to be success and disappointments. Many drugs, for example, like just last week, GSK in UK agreed to pay a sum of 2.2 billion pounds or dollars to about 8,000 victims of Zantac, one of the drug used for gastric, and we all used it like a couple of years ago. But once it's pulled off the shelf, then what do we do? Because we were told that this drug works. I'm not doing the research.
Yeah.
But if I'm suspicious of something, that I'm seeing something which is not right during the pandemic, that I have to say, like, look, I see something sinister going on here, and I'm not going to I'm going to be giving you extra precaution to think about it whether you want to take it or not. So when it comes to this Q denga and all at the moment, it is still under conditional registration.
It's
So
not
when-
registered in Malaysia.
No, it's registered as under conditional medication.
Okay.
So we were at the infancy of producing a dengue vaccine. I think when Datuk Sri Liao Tiong Lai was health minister at the point, it was not successful. So it was a burn operation, and there were trials in Mexico. They were trying to produce a dengue vaccine at the point. Not successful also.
Okay.
For example, like maybe there are who knows trials going on to make vaccines for HIV and stuff, but not successful because of the virus and how they react and stuff. So when a product goes into like conditional registration, the first thing I ask is like, why conditional? What are you worried about? You're a regulator, right? If you're not you're not confident with the product, why you put it conditional? Put it lah, fully use authorized product. You so right. So that's the thing. And then one more thing is I don't think it's resistance, but people have to pay for the dengue vaccine so it's out of pocket. So if it's introduced into a government system, there may be some people who would want to consider to take it. That's another thing also.
Now, before we go deeper in this topic, again, this is a layman question. Are these viruses, the Mpox and COVID and all that, are these viruses man-made?
No, some viruses are not man-made.
Okay, but some are.
Some could be.
Okay, could be. It's a very conspiracy question.
I'll wait for someone to lead the US in a couple of weeks.
Okay, now this brings about another interesting point, because when we talk about side effects of the vaccines now, are we as a nation, as a people, prepared or doing the right thing when it comes to how we respond to vaccines? Are we blindly taking vaccines without really understanding the side effects?
I think we need to reword this whole this whole text you mentioned. See, I think after the 2020 pandemic, and when they rolled out the vaccine, first they said it was not mandatory. But they were cynically trying to introduce it, force you to go into
They
go
said your
shop.
life will be very tough.
Yeah,
and all that,
they're going to make life hard. So that made a lot of people like, look, if I really needed it or not, I have to take it just for the sake of taking it. Okay. Today we see the errors being done. We knew today that that it didn't stop transmission.
It didn't, yeah.
It didn't stop transmission, which was first told. So it's a misinformation. It didn't provide you a very good starting immunity. Not like those things like a hepatitis B vaccine or
Typhoid and all that.
typhoid
Yeah.
and polio and TB and stuff. And then you said you need to take the third one, take the fourth one. Why? They knew about it. These people didn't know about it here, but the manufacturers knew about it. They knew the immunity was waning already. So they knew the third one, fourth one. Some people have taken till the eighth one in US. So
Eighth booster.
eighth booster, yeah.
Jesus.
So it's becoming like an influenza vaccine, like you take it annually. So now does everybody need an influenza booster? Now? Let's go to something which simple that everybody knows, like flu season, we take it. And it's been done like for decades. In the countries which in cold environments, they will opt to take a influenza vaccine. So here also is the same thing. Some people travel towards the year end and everything and say like, can I come and get the flu shot? So I say, fine if you want to take it. If you don't take it, what happens? If you catch a flu, then maybe you might have a bit of more resistance. But if your immune system is very good, then maybe you just have a 1 or 2 days cough and cold. But that's not going to be the same for someone who's 80 years old or 90 years old. His immune system is not as sterling as someone who's in their 30s. So when we think about something like this, we cannot just throw out the net straight and say everybody needs to take something. We need to be a bit meticulous on who was to take. And what we saw in the 2020 pandemic and when the rollout went on, we started seeing that younger males were not suitable to take the mRNA. They were having myocardial infarction. They were having myocarditis. There was sudden death. But the acceptance of sudden death is not told in public. But when they go into court, oh yes, people died because of myocarditis. That was said. If you look into the papers, look what he said. I don't want to mention his name. That's what he said in court. Then why didn't you allow us to have a voice and say, look, what I was saying was, look, people need to understand that who needs it, who doesn't need it. But when you force everyone to take it, there comes the collateral damage. It happened if the data showed like 1 in 10,000 people are going to have something. If it's 100,000 people, you're going to have 10 young boys. If you have 1 million people, you're going to have 100. If you're going to have 100 million, you're going to have 10,000 people. So is that number significant enough? To have young people who might just have a common flu and recover in 3 or 4 days, who don't have diabetes, hypertension, thing, the risk of mortality or death is most likely 99.99% they will survive. They will introduce a product which now they are in risk of having myocarditis, having sudden death issues, and having immune response issues, rather than just having it was something maybe slightly higher than a common flu. So this is the thing when you say like, look, the risk benefit should always be a discussion with you and your physician, not you and the state.
But sorry, but on that point, I know that you guys can check out his TikTok channel where you talk about the court case and you actually talk about the issues with the COVID-19 vaccine and all that. But I have had conversations with, especially this one doctor who I'm sure you know him, but I won't mention him here. He's a very senior OBGYN in Malaysia. And I asked him about the vaccine, but when it was, when I had my first child, and I said, my wife was pregnant. And I said, if she needs to take the vaccine, will it affect the child? And he told me this very clearly. He said, the debate about this vaccine is taking place in the newspapers and not in medical journals. Right? So, but he told me that, and then he never gave me a conclusive answer. But I know what he was trying to tell me. Now, are doctors such as yourself complicit in this? Because do you think the doctors do enough to protect us from this vaccine? Because I remember when the vaccine was first announced, when COVID was first announced, there were a group of doctors, I think in Australia or somewhere in US or what, who were actually talking about how this virus is not as serious as people think. There were alternative options and all that. So, do you think that doctors should be held responsible? Because in this case, they were not the opposers of Big Pharma, but they were more the administrators for Big Pharma to implement this vaccine in us, inject this vaccine to us, regardless of its side effects and long-term impact.
Yeah, definitely. But today the damage is done.
Okay.
So even though we can cry, weep, and everything, you can see the public outcry. You could see that. You could see the response today. And today, the biggest problem we have is the distrust and the trust loss towards good vaccines. Example, like I will have moms call me for a consult and say like, should I give my kids vaccination? I don't want to take. This is the ones who are maybe more educated and concerned. They want to get an expert opinion. And we do not know what's even going on in the kampungs and everything after this. How many people are taking? If they were honest, they would show the drop. And definitely there's a drop. I know for sure there's a drop. But what we have to do now, pick up this beaten issue now and say that, look, there is a need for BCG. you don't want your kid to have BCG. You don't want your kids to have polio.
Oh, you mean even these basic vaccines?
They don't want, and that's a big problem. So and we have to educate them, and I give them like, why do I need to take pneumococcal? Why do I need to take this? I say we need to understand that you are sending your kids to nursery school. How many kids are there? Do you know where the parents work? So you need to also understand, like of course we had maybe like 5 vaccines when we were kids, but today maybe they're having maybe 8 or 11. And there's also questions today like, why Sabah Sarawak got extra vaccination compared to Semenanjung?
Okay.
So this is the part of the national immunization system. But there are other vaccines. If you go to private, they will offer you like rotavirus and stuff like that. So with this scenario, there has been a lot of distrust because you did not allow the physicians to discuss this with the patients. We didn't allow physicians to say, yes, is there side effects? Definitely there is side effects. See, like in US and other countries, like more advanced countries, there is sort of like this protective system where if any of the child has a vaccine injury, there is some form of compensation mechanism. But unfortunately, what we saw during COVID was like certain serious issues, they were only paid about 2,500 ringgit. So what was offered like 500,000 everything for death and stuff, people only ended up with 2,500 ringgit. So the payout was only about 2.5 million, something like that.
Now, of course, now we are seeing like with Mpox now. I mean, for a while, I was a bit scared. I said, oh my God, another pandemic, But I saw your video. So I said, okay, then I guess it's fine. Because,
Thank you.
Yeah, I was like, okay, thank God. And by the way, I do call him sometimes for unpaid advice on medical, especially my daughter. But now, is the way of, I mean, you being a doctor, you've seen many patients. Is our way of life now, the general way of life of John and JNQ taxpayer now, making us more susceptible to illnesses and these sort of super viruses that are coming out?
Definitely.
And in what way?
Lifestyle again. So we're not getting a lot of sunlight. I mean, I call it in my wellness conference, which I just did last week. I call it the box to box cabin generation. So we're moving from one cabin to the other.
Yeah.
So we're moving from a condo into a house and then into a nursery home, and then the kids being picked up after 7. They're not seeing the light. They are going to a nursery home, which is maybe on the 3rd floor of a building. They're not seeing any sunlight. They're not going out to the park. They have no contact towards nature. They're not seeing enough of sunlight, so they don't have enough of natural prebiotics. They're not getting enough sunlight, so the immune system is down. So they are very susceptible to illnesses, despite some of them even completing all their whole vaccination program. So lifestyle is a big thing. They are so engrossed with gadgets. And so one guy gets a flu, then spreads to the whole classroom. I mean, I would remember the days that how many times I was absent in school. I probably would count them. Then if I was absent, I was most likely absent maybe for a day.
Yeah. Back then you couldn't be absent. Your parents would kill you.
Exactly.
Yeah.
But
What
today, if my son comes back with a flu, that's it. Whole week, no school.
Yeah, no school. Yeah. And then the other parents also don't want you to come.
And then we can also see from their WhatsApp chat like how many kids are not coming to school, and those numbers are significant. We had like in a class of 30, 35, we already had like 1 to 3 maybe maximum were absent that day. But today is like half the class, 5 people, 10 people absent. Oh, sakit.
No, interesting you bring that up because and please share your thoughts. Are we mollycoddling our immune system? Because when I was growing up, when I was a kid, do you remember chickenpox?
Yes.
My parents, when they heard their friend's family got chickenpox, they will bring us there to get it young because chickenpox is very deadly.
They call it the chickenpox party.
Yeah, because if you're older and get chickenpox, it can be deadly. I've seen old people, my goodness, it's terrible. But when you get it young, nowadays, a bit rain cannot go out. This child got
5 o'clock to 7 o'clock, dengue time. Don't go out.
Yeah. Are we mollycoddling our immune system?
Definitely. So we're not exposing the immune system even at a younger age. But I'm not recommending the chickenpox party lah. There's chickenpox vaccine tours
which I'm not taking. Giving my daughter the natural.
So I mean, there's always those options. but also to consider like certain kids who are immunocompromised. For example, like when you said, like if you have a very healthy daughter, it's fine. If she gets it naturally, she will survive. But comes in maybe a kid who has eczema and constant asthma, he gets a pneumonia every year, and then like me, a physician, like now you have this technology here where I will not take any chance with this kid. I rather give her the option of the shot than allowing her to get it naturally, because I will not know how will she react. So I've got to mitigate the risk versus benefit. That said, again, it's a discussion between the physician and the parents. If the parents are the parents understand the risk over benefit and say, okay, fine, we go for inoculation. Then I, with the powers I have, to introduce the vaccine. But if the parents say like, no, I think we will try other methods. We will try to improve our immunity. Yes, focus. We can still discuss on that ground. So I think, again, like I said, medicine is private. It's a one-to-one basis with your physicians, and you need to make sure that you at least have that one person.
Just to share a story, when my daughter got very sick once, I called Dr. Roland, and then he told me it's my fault because I'm practicing box-to-box sleeping. Such is the care that, the tough love that Dr. Roland shares on me. But it worked, because now in the morning I take my children out for sun.
Good job.
Yeah. So now, recently, of course, there's another issue where the related issue where the Malaysia Muslim Consumer Association, in fact, I spoke about this to I forget his name now, but you know him as well, the PSM president. What's his name? Not PSM. PRM. Yeah, Ahmad Juflis.
Okay.
He brought this up as well. They are set to initiate a class action suit against the government on behalf of those who have experienced side effects or died as a result of the COVID-19 vaccination. So, do you think that this is fair? This suit?
It is fair. It is fair. I think a big organization like them have the armory to do so. And I think many individuals who suffered, I think maybe don't have the deep coffers to proceed with such suit. But I think as one of the biggest consumer association in Malaysia, I think it's fair for them to pursue something in this situation. I mean, like on myself, like my court going on process, it's all about this. In fact, it's in regards to information. I mean, when you are administered a product which is still considered under a position of temporary registration or conditional registration, so I speak, and if you were not given the exact information, then you were misinformed, and that's not right in medicine. And this has happened not just here, but all over the world at that point. Okay, it's hindsight is 50-50 lah here, but if we knew something was not right, why didn't you bring us to the table of discussion? Maybe we had decent evidence, we had peers overseas already ringing the alarm bells, but no, it's like it's either like my way or the highway at that point. But today we are seeing the repercussions. So it's just not just about the victims today. It's for me, I feel it's like we should never do this mistake again ever, because I think this grows to like the greatest crime ever done in the 21st century.
Definitely. Now, I want to close it up on two things. Of course, now when you look at how we treat COVID-19, it's like a flu now, right? With all the fear-mongering that happened during that time, with all the articles that came out and all the headlines, and we were all, locked down, it was like a scene out of dystopia or whatever the movie title is. Was it an overreaction? And do we, as a race, as a people, overreact when we hear news about pandemics now? And we should instead not do that, but rather take a step back, learn about it, and be more focus on being more knowledgeable about this fact, as opposed to just responding with fear.
I think people are still going to react the same way because they know how to program this. And when it comes to medical knowledge, like, let's just say there's only about 78,000 or 80,000 physicians or practicing doctors here. whether they come in from 60% belong to the government agency. So technically they are not going to open their mouth because they are sworn to act and all the laws against the public servants. So you're not going to get anything from them. For them, it's just like, tell me jump how high, because the pension must run.
Yes.
That's a fact. And that's what we saw. Then you are down to maybe another 35,000 outside there, who maybe like 70% of them are specialists. So they are so busy with their specialization. They're not going to go and jump and worry about anything.
But doctor, come on.
Yes, yeah. But then you are just left with a few outbox doctors who are looking at, something is not right. And another scenario I put to you, it's whether you have the audience or not. I had the audience from 2014. I have built online content for years. It was not only like COVID-19 tarang, I was there. No, I was there. So people were listening to us. People were listening to medical tips and advice. And when we said, hey, I think something is not right, boom, go get that guy.
No, but you see, the pushback I would give on that is that number one is, I think, about the reach. I think in today's world, social media is different now. Like, for example, you can have a channel that has maybe 10 followers, but you can have a video that has a reach of 1 million because it's about the content, right? But when the problem with doctors that I have, and this has always been a source of annoyance for me about doctors, and sorry to say, I know you're one, but let's
I like that.
Okay, is that you benefit from the fact that your position is almost worshipped. Okay, if you look at...
I agree with you on that point.
If you look at religions like Islam and Hinduism, especially Hinduism, medical teachings or medical lessons are taken regarded very highly. For us, it was part of a Veda, right? Modern medicine is based on the Ayurveda, right? So, but you cannot have the cake and eat it. You can't say, okay, you guys, when you come to my clinic, my hospital, you give your life to me. You say, I trust you, doctor, to take care of me. But then when it comes to standing up against issues like vaccines, or, we can't because of this. Okay, fine. I understand that people respond to incentives. I understand that I need to worry about my pension. I get it. But shouldn't more doctors in the private sector be like you and stand up and say, no, guys, you shouldn't take this because this vaccine is not proven. I've spoken to retired DGs who have told me that a vaccine takes years. Even the trial periods, you have to do different countries, different demographics. This was sort of like, today got problem, 6 months later we got a vaccine. So shouldn't doctors be...
And again, there was just jump a bit. There was no issue in the technology, how fast the product can be made. It's all about testing how good the product
is.
Yeah, exactly.
But shouldn't doctors be more like you? And it not be shouldn't, they must.
I'm not trying to be the angel here, but I think this is part of our oath. This is the bare crux of it. It's the oath. It's like, you do no harm. If you see that you cannot manage, if you see something, look, you need to tell your peers. Yeah. Or if you cannot manage it, pass it to your peers. But in a situation where everybody is sort of like silent about it, because even in private, I know the situation, what happens. The CEO gets a call. Why did one of your specialists make noise about this? And not just that, I'm going to go to academia. I know certain professors were called up in big universities, national universities, and said like the chancellor said like, you should not be talking like this. Where would the research funds come from if you keep going against them? We're not getting enough funds from the higher education ministries. We're getting funds from research, fundings, and everything. And he left. There are experts who left academia because they were against it. Like they said, this cannot happen. I'm not going to mention names. I'm not going to mention institutes, but it did happen. Letters showing disappointment with your professors, issuing statement, coming out on press, making statements. But these guys are the top experts. Not just here. I'm talking about it. It's a worldwide operation. So if you're talking about this is like they just don't want to comment because they're just not part of it. It's or even like other issues also. If like I'm not part of it, then let's just stay away. I'm an orthopedician. I'm not going to give any vaccines. So not my problem. Kind of thing. Or you're too busy with again with your practice. I mean, it's not even wrong. It's not even wrong. Like I cannot handle all the medical problems in the planet. Can I? I can't.
No, but you can stand up for things.
But maybe in my position at that point of looking at it, all I said was, look, in that position, I knew no one in this country would have been able to do that. No one would have been able to pull that out. You have to do it, Roland. It's like it's a suicide operation. It's a kamikaze operation. You do it, drop mic, now come and get me. Because I'll ask you a question. How many people are trained with like me? I've served in clinical and administration and expect to the perspective of these legal issues. I knew what was going to come. I knew what was going to come. But do I die in peace if I don't say that?
Yeah,
that's the thing. So it's not even being like just because I am a practitioner. It's like, look, everything was set in line.
Yeah, everything. Yeah,
you had to do it.
Okay. I mean, we have been focusing a lot of the negative sides, but do you think things will get better in the healthcare system?
Definitely. I think awareness after the pandemic is significant on healthcare. I think healthcare is a boom market. There's going to be a lot of hospitals, going to be a lot of wellness centers, going to be a lot of products. And I think innovation among our community in Malaysia is also pretty good. I think as we look at investment coming a lot, I mean, I see one thing that the ministry doesn't have is an investment wing.
Actually, you're right. They don't have, right?
Yeah, don't have an investment wing. So a lot of ministries have investment wings, like how we look into aggregating the healthcare industry. Like, of course, we have this MHTC, Malaysian Health Tourism Council, but we need to see like how we aggregate into the pharma business, how we aggregate into getting more hospital investments coming from overseas. Medical schools, we already had that, but we need to see other dynamics, especially the pharma, because see, Southeast Asia is a huge market. Maybe in the next 10 years, we might be already a billion population. So that's huge and geopolitically strategic with whatever we're looking at, whether it's going to be more inclined towards BRICS in the future, and also understanding that they're the crossroads of two giant nations, India and China. So we need to see now how we're going to bring them into this point, whether we can develop what we did in the 70s into the semiconductor industries. You see today why we're having a lot of investment coming in because of that know-how knowledge of semicon industries in the 70s, 80s. So they feel like, look, you got expertise? No, we got expertise. So we got to look on those segments. And in terms of healthcare, you're looking at, I think, again, preventive medicine
is the way to go.
Is no choice. We have to do it unless, or if not, the whole government health system swells up.
Do you think that that medical practitioners from in a post-COVID world that we live in are forced to, especially, look at the human condition in a different from a different lens? Because previously, before COVID, as I mentioned to you earlier, it was as a patient, it was always looked upon from a symptomatic stance. It wasn't looked as a holistic. Now that, because we talked about lifestyle where we have so many bad habits, right? Do you think that the future of medicine is in assessing an individual from a holistic perspective, like what you do, as opposed to what most doctors do, which is just, you have fever, I'll give you Panadol?
Again, it goes down to one thing. It's demand and supply. We want to move towards a more quality healthcare, not quantity healthcare. So if you're looking at quantity, I have to clear the traffic. So that's that 3-minute medicine and pharma, polypharma. I mean, more drugs, clear out. If you're looking at quality healthcare is like less drug, more discussion, more planning, more discussion of you rather than me pushing you. It's like I need to understand you, how to help you in terms of how to look at improving your sleep. Of course, yes, there can be use of drugs, there can be use of supplement, there can be even intervention of food, sleep, and everything. So many things coming up. Wearables, smart drugs, all of these are there. So will this industry develop? Yes, but how do we keep it in a balance? That's going to be the dance.
Do you think that there is enough regulation on Big Pharma?
There is.
There
is regulation, but it now goes on to the regulators whether they're competent.
But they're willing to enforce. So, I mean, that's a wrap. It's always been a pleasure talking to you, Doctor. This is the first time I think I think you, in keeping with your ways, you have offended many people, or at least
as usual.
Now, to everyone, I must apologize for the coughing. I'm just recovering from a bad cough and flu. But thank you so much, Doctor. I'll give you please have your last words in this.
Thank you so much for tuning to the GoodCastShow and Lesung Batu Medic Show.
Yeah.
Till we meet again, kita lesung kau.
Okay, that's what you do. Okay, thank you guys so much. We'll see you all soon.
If you want lesung, you can lesung.
Yeah, that's one more time. Yeah, all right. See you. Bye.